Akon got a hair transplant. Some people are telling that Akon's hair transplant looks awful. Is it so? Is it really a blunder? Or there is a science behind it? The technique which he chose, is it the best technique? Oh, he saved his money by choosing a cheaper clinic in Turkey. So, has it costed him something huge? And what should be the approach while dealing with patients who have curly hair? All these answers you are gonna know when you watch this video. I'm your friend Dr. Shaill Gupta, and I've been doing surgeries for past 20 years. Now, if you haven't already subscribed the channel, please subscribe it and don't forget to press the bell icon to receive all the notifications. So recently we came to know about Akon's hair transplant, where he was in a podcast and he told that he got a transplant done. Before that, everyone was speculating, okay, probably he has got a transplant done, or he's wearing a patch, or what it is. So he revealed this himself, and let's see how his journey has been through last maybe 10, 12, 15 years. So this picture which we are seeing is around 2010, where his hairline looks okay. His face is slightly, forehead is slightly broad, and though it maintains the proportion like one third, one third, one third, and it looks pretty decent. Over a period of time, he kept thinning and slight recession of hairline happened. In this picture, which was taken in 2012, we can see there is some sort of straightening of his hair, though his hair are very curly. Probably he got it straightened through some chemicals, but he was hiding his forehead and he was lowering it. Probably he wasn't comfortable with the forehead broadness. So he decided to do this to hide it with straightening of hair and combing them down. Though it is very difficult for African patients who have very curly hair to comb them down or to cover it up. So mostly they cut their hair very short. So this picture which you are seeing is around 2019, when we can see there is little more recession and more broad forehead can be seen. Now, probably this time around, he opted for a hair transplant, and then we see this. This is the picture where we see him having hair in the entire portion. And in a recent podcast, we saw he revealed that he got a transplant done. Before that, everyone was saying that probably he's wearing some sort of toupee, or maybe this is a hair transplant. There were people who were claiming that this is a toupee because there was a low hairline and nothing was done in the temple portions. So now there are a lot of people who think that this is not a great transplant. There are people who think that this is okay. There are some people who are making fun of the hairline. So let's dissect this result. Let's go dig deeper and see what has happened in Akon's case. So first of all, the hairline. Uh, if we see his hairline, this is quite low, and if you see the proportion of his face, this is smaller than the lower one third or middle one third, which makes it look little unnatural. Although it could have been a little higher, maybe a subtle work in his hairline would have looked better. As far as the hairline design is concerned, this is, I think, very much personal. A lot of people, African people, they have this kind of haircut. They have this kind of hairline. Even if they have hair below this, which are not actually going straight, they sometimes just shave it off to keep that straightish look. So I think there are ethnic variations also. So in certain communities or certain ethnicity, this is considered good and smart. So I think the choice of hairline is with Akon only, and we cannot comment upon that. Yeah, but it could have looked slightly not that straightish, maybe just a little bit of natural variations here and there, up and down, not really making it too mechanical, but yes, working on the hairline with softer hair could have made it look more natural. Another issue which is popping up is the temple creation. So, as we can see, we don't see much of temple in his hairline, but yes, if you take a look at his pictures, it seems pretty okay. I mean, even if a temple hasn't been made, probably temple would have made it look little more natural. But yeah, the kind of hairstyle which he's having, I think this is still okay. Now, another important thing here is he was probably 46 years of age at that point of time when he chose for a hair transplant. This is a very good, decent age for a hair transplant. And in fact, I also went for a hair transplant at similar age, like 45 years of age. And coincidentally, I am also a musician. So, I had also a slight recession, like in the frontal portion, and rest was good. Akon also had the similar case, just frontal recession. So I went for the transplant. I am not taking any medicine, minoxidil or finasteride, and I hope Akon is also not on any medication because a lot of transplants which are without medicine, they don't look that good. But yes, any transplant can be made look good with medications, with finasteride, because it grows a lot of hair in the transition zone and it grows a lot of small miniaturized hair even below the visible hairline. Okay, so apparently completely bald area, but you still get a lot of softer hair which camouflages the gaps between hairline. So if he's not on any medication, I won't have recommended him any sort of medicine, considering a very slow progression of disease, small area to be addressed, and good donor, and his age. So but yes, if he is on medication, then whenever he stops these medicines, minoxidil or finasteride, there will be a rebound hair loss, and he cannot stop these medicines. He has to keep taking them forever. So at this age, when you are going for a transplant, and that too for a small, subtle area, then you don't really need to introduce these medicines into your ecosystem, and you can opt out of them. But for that, you really need to choose a surgeon who can deliver the results without help of medicines. And a lot of people are under this belief that they need these medicines for initial period, maybe a couple of years or a couple of months. Not that is not the case, because when you stop these medicines, the rebound can be very, very severe. Now he went for this transplant in Turkey because he found it cheaper. Now Akon obviously can afford. He has money, but still at subconscious level, sometimes it plays in the mind of person, because uh, they can spend on cars, they can spend on phones, they can spend on mansions, but sometimes they don't spend on their health, which is obviously not good. He should have opted for any surgeon who he considers best, rather than going in for a cheaper option. Spending money may not necessarily mean that you are getting quality. So if the baseline is same, like if the surgery is done with the support of medicines only, you may not get actual transplant through the skill of your doctor. Rather, it can be just a camouflage, and medicine might be playing even 70, 80, 90% role in hair transplants. Now, There are people who are losing hair at rapid pace, or where hair loss is progressive. They are the ones where medicines should be introduced. But the dosage of medicine also is important. You can watch the playlist given in description, where we have discussed the role of medicine, how it impacts donor, how it impacts transplanted hair, how it impacts existing hair, how it affects the density, coverage, and everything. Now, another important thing he mentioned here is he went for FUE. Now, here I beg to differ. Uh, FUE is not the right technique for a patient who has curly hair and as curly as Akon or maybe other people. He might be having little straightish hair, because we could see some straightish hair with straightening, and which he maintained for quite some period of time. But yes, not everyone has that leverage of getting these grafts out with FUE. So this patient is again an American African. He came to me from US. We operated him. Now he was also kind of keen to get this surgery through FUE. So we gave it a shot. You can see here in this video, I was doing extraction, and out of 10, only one graft came intact and rest got cut, because the hair curls underneath the skin. So if you see these hairs which we took out, see how it is making a C or a U, and this curling can vary in individual to individual. All African patients who have curly hair, if they go to a clinic which does only FUE, they don't have option. And if the grafts get cut, they will be wasting those grafts. So we just switched. We did FUT in this patient, and you can see the strip also. The hair are curly at the edges. You see their hair are making C's or U's, and they are going this way. And obviously, when we are doing an FUT surgery, we cut the strip and dissect it under microscope, and these grafts are visible. You can without cutting them, you can dissect them and use them. So this is the advantage of FUT surgery in case of African patients. And if you see this patient's, I think this is around 10-12 days picture. The absorbable stitches were used on the scalp. You can see here it is healing pretty well. So the donor is quite good, and just by a few T, we got good numbers. And now, another important thing, the density above and below in the donor area remains untouched. Now, look at the hairline. In case of Akon, you see it's quite flattish. But in this case, we did not give a very, very flattish hairline, though we had a long discussion with the patient. We designed this hairline in a different way. We worked upon the temples, subtle work was done on the temples. Majorly, the hairline was done in a beautiful way, so that it doesn't, I mean, it's not an Asian hairline or a Caucasian hairline. This is still very much African hairline, respecting the ethnicity and everything. But yes, still it is not that flattish. So, but yes, personal preferences might be there, something which we don't find good, even if the patient is insisting for that. And if we think that it's not gonna look good, or maybe not good for long term prospects of my patient, I will never do it. So this airline will keep you updated, we'll keep you posted as soon as we get the result of this patient. This we operated him around 18-20 days back. Suppose if you go to a surgeon or a clinic which does only FUE and doesn't have the expertise to perform FUT, what do you expect? They will tell you that we have some special skill. They will sell you this FUE technique by different names. You will find a lot of names, and people claim that we have patented technique, and this is something which only we have researched and done. We have special equipments where we can even take out these grafts, the curved, everything. Yes, but it is, very difficult. Just don't believe it. It's always good to have options. As we did with Mr. Brown, he had options because he had chosen Satya, and he had chosen a surgeon who was confident and competent in both the techniques. And in Turkey, most of the clinics, as far as I know, are doing only FUE surgeries. Uh, uh, Across the globe, in fact, I would say most of the surgeons in India, in US, they have shifted to FUE, or the newer ones, they haven't learned FUT because they just find themselves comfortable with FUE, as it has a shorter learning curve. So, but again, this is up to you, because eventually your health will get affected. Your donor won't be used to the fullest. And to make full use of donor after FUE, obviously there are gaps. Still, in such cases, we can do FUT. But in cases where we are, repeating FUE from the same donor where we have already done, it will create huge gaps and it will almost devastate the donor, as you can see in these pictures. So in fact, scar is the biggest tool which people use to coerce you, to push you towards FUE, so that you get scared and don't opt for FUT. I would rather say FUT scar is the biggest advantage, because you end up having a thin linear line because of trichophytic closure, and even if the scar is bigger, the scar can be covered by putting some grafts, maybe 100 or 200 grafts. But if you think that FUE is a scarless surgery, no, it isn't. You can see in many patients, you will find these many scars, and these scars are exactly the same numbers which have been extracted. So suppose if I'm doing 2000 FUE, I'm creating 2000 scars. And these 2000 scars, if I want to fill them, I need another 2000 grafts to fill them. And from where I take these 2000, I create new scars. So practically, it is an endless story. So FUE is not a scarless surgery. This is one of the take-home messages. So to summarize, I think we should not criticize or the surgeon or even Akon for getting a hairline which he has got. It's his personal preference. He is spending his money. He is using his donor. The doctor has done a decent job, and though it could have differed a little, and definitely the method of choice would have been FUT in his case or similar cases. And so the take home message is hair restoration is obviously a journey. You need sometimes just transplant can do, as it did in my case. Sometimes you need medicinal support. And second, method. So do your research, dig deep into it, know more about FUT and FUE. Just don't believe if 10 or 100 people are telling you the same thing. It doesn't make it truth. I think the quest to find the truth will get you the right solution and will set you on the right path. With this, I end this video, and thank you for listening. If you have doubts, if you have questions, you can ask in the comment section. If you really want to dig deeper, go to the website www.satyahairsolutions.com. There are blogs, there are some case studies, big number of cases where we have given details, what we did, how many grafts, what method, why did we choose that method, if we gave any medication or not, if we gave, why did we give, and if we didn't, why didn't we. So if you want to plan your journey with us, you can fill the form given in description. There is a beautiful blog on our website. You can go through that blog about curly hair transplant. So I hope it will help you. To make the journey easier, we have formulated a 7-step guide, which is there in the description. You can download it for free. Thank you. Love yourself.